I think it is very important to acknowledge that culture plays a major role in psychiatric conditions for a number of reasons. Culture determines what is normal and what is abnormal. Culture can influence presentation of symptoms, how people present and where they present to. Culture also influences where we seek help from, how we seek help, how we accept it. Culture can cause psychiatric symptoms, it can perpetuate psychiatric symptoms, and it can also help deal with them. In practical terms, everybody has culture. Every professional has culture, broad cultural of their upbringing, but also the culture of the institutions, of the organization, of the place they work in. What we need to bear in mind is that cultures are imbibed. We learn as we grow up. We are not born with a culture, we are born into a culture. And when we look at the role culture plays, it helps us think of social development, emotional development, as well as cognitive development. The way we think, the way we see the world, is all formed and influenced by the culture. And cultures can be of very many kinds. Different types of cultures have been described by sociologists and other professionals. Cultures can be sociocentric or egocentric. Cultures can be masculine or feminine. Cultures can be loose or tight. Cultures can be open or closed. Cultures can be multi-reactive. So what that means in practical terms is that we all have multiple micro-identities which are influenced by cultures, and cultures determine what's normal and abnormal and how we respond to that. In practical terms, when we see a patient from any culture, we need to put them at the core of the therapeutic interaction, and they are surrounded by their family, their community, and culture as a whole. In that context, understanding the cultural background of the patient can create a sense of belonging, a sense of purpose, and sense of understanding why they're feeling like this and why they're feeling like this now. We also need to be conscious of the fact that culture plays a major role in acceptance of various kinds of treatments. Most of the psychotherapies or talking therapies are ego-based and have Western models, but they can be adapted, they can be modified according to the needs of the culture to which the patient belongs, provided the therapist is open-minded enough to look at what needs doing and incorporating the local cultural values, local cultural strengths. Clinicians also need to be aware of the strengths and the weaknesses of their own cultures. Every individual has at least one prejudice, whether it is to do with anything specific or unconscious bias or other things. Awareness of the weakness of the cultures and strength of the cultures is absolutely critical. That helps us engage the patient. That helps the patient understand what we are trying to convey to them, so that you can form a proper therapeutic alignment which will help the patient. Cultures also influence the way people see the role of medication. Some cultures like and prefer injections, others prefer syrup, some like big tablets, some like small tablets, some prefer blue colored tablets which are seen to be calming, and some like red tablets because they seem to give them more energy. One of the major tasks for any therapist is to try and explore the perceptions that patients have of the medication as well as of talking therapies, and you need to engage with the patient by exploring their explanatory models, how they see what they're going through. And there is a model where a clear distinction between dis-ease or disease and illness is paramount. Quite often, health professionals are trained to deal with diseases because it's about pathology. When disease affects patient's social functioning, it becomes an illness. When it affects those around the patient for whatever reason, say for example, patient stops going to work or has to take time off work, that is affecting others and therefore disease becomes an illness. Patients are much more interested in dealing with illnesses. Doctors and clinicians are much more interested in dealing with diseases. In order to deal with illness, the role of culture is paramount because it allows us to explore what the patient's explanatory models are, what they think is wrong with them, what they think caused it, what they think needs to be done. And that is something that the clinicians must be aware of in the context of culture of the patient, but equally importantly, their own culture and culture of the organization they work in.